Hi, and welcome to the Healthy and Happy Lifestyle Summit. I'm Dr. Sheetal Ajmani. I'm a pediatrician, best-selling author, Ayurveda lifestyle consultant, yoga instructor, and your host for the summit. Today, I'm joined by Dr. Indrani Raman. Dr. Raman is an integrative and functional medicine physician who is triple board certified in internal medicine, nephrology, and obesity medicine. As a kidney specialist, she has seen the end results that comes with uncontrolled diabetes, obesity, and poor nutrition on people's health. To help people address root causes and prevent disease rather than treating symptoms, she pivoted her career to holistic medicine. She's passionate about combining her extensive knowledge of conventional medicine with holistic approaches to help people lose weight and heal their health conditions. She is the founder of Excel Health MD, an integrative medicine and weight loss practice based near Dallas, Texas. Today, she's going to be talking to us about a holistic approach to managing insomnia. So welcome, Dr. Rahman. It's an honor to have you here today speaking with us.
Yes, thank you, Dr. Azmani. Thank you for that generous introduction. Hello, everybody. I'm glad to be here. I want to acknowledge Dr. Azmani for doing such a wonderful job in bringing us all the doctors here together to provide these generous and great lifestyle tips so that everybody can benefit and improve their health. Happy to be here, and we can get started. I'm glad to talk about this topic, which is a common complaint for so many people.
Yes, it's something I feel like many people struggle with. I've had moments and phases in my own life that I've struggled with it as well. So to get started, can you tell us what is insomnia? How would you define it?
So roughly, insomnia can be defined as any sleep which is not satisfactory to the person. You can say it can also be divided as a difficulty fall asleep, or difficulty to maintain sleep, or frequent awakenings that happen at least few times a week. There are certain formal ways that you can define insomnia. You can use a sleep diary. You can use standardized forms like Pittsburgh Scale Index and things like that. But roughly any sleep which is not satisfactory to a person can be defined as insomnia. Now, it is a very prevalent issue. One National Sleep Foundation says that 60% of American adults suffer with any type of sleep complaint at least few times a week. There are more and more studies which are showing that sleep should be considered as much and should be given that much importance as nutrition, physical activity, and stress management for anybody who's trying to maintain optimal health. One of the other things I always recommend when people come with sleep issues is also definitely they need to be screened for sleep apnea, because that can be seen in almost 20-30% of these people with sleep issues, and also screen them for any kind of mood disorders, with like depression and anxiety and things like that.
Definitely. Wonderful, wonderful. So that's a pretty large percentage of people who are struggling with some sort of sleep issues. And I want to just kind of highlight a few points that you made there. You know, what I'm gathering already is that it can be very multifactorial, that when someone comes to you complaining of or seeking to address their sleep concerns, that there are many things to consider. There are many factors that could be involved, such as sleep apnea and mood disorders, that need to be taken a look at.
Yep.
And the other point that I want to highlight that you made is that sleep issues and insomnia can show up in different ways. So you had mentioned that it can be difficulty falling asleep or multiple awakenings at night. So really, it can present itself in many different ways. It can look
Yes.
in many
And
different ways.
yeah, in fact, 40% of complaints that when patients go see a primary care doctor, 40% of them complain about sleep issues. And I think we are not even asking the right questions. All we ask them is how many hours are you sleeping, right? But even if they're in the bed like 8 hours, they may be not getting the good quality of sleep. I think rather we should ask them, are you feeling refreshed in the morning? Are you taking any daytime naps? Do you feel like you need to lie down? How many times are you waking up at night? And then when you wake up, are you able to fall asleep right away? Are you still struggling to fall asleep? So I think those would be the way to approach. And some of the questions I think we can all add in our question bank when people complain to us about sleep.
I agree. That's wonderful. I think those are all really wonderful questions and a different way to approach and really assess how someone's sleep is and how restorative it is. And that's what was actually going to be, and probably leading into my next question, which is how do you screen people for insomnia?
So the first step would be to use a questionnaire. And I think it's better if I start sharing my screen here.
Sure, that would be great.
All right. Okay. So like I was mentioning, like the Pittsburgh Sleep Quality Index is a more formal way. And I think the other way we can start is by doing sleep diary. Ask them to keep a sleep diary, and then where we can actually track about their awakenings and how much latency they have before they go to sleep and how they feel in the morning when they get up. So I also want to mention that sleep, I'm going to talk about here the framework that I really like and have been using in my own practice. It comes from Dr. Rubin Neyman. He's a faculty with Dr. Andrew Weil Center for Integrative Medicine, and he is a sleep expert. So he says that sleep should be considered as a reduction or dissipation of energy, along with maintenance of normal nighttime level sleepiness. So by that, what I mean that anything that interferes with sleep can be related to excessive energy. Our body normally wants to produce the normal nighttime levels of sleepiness. But if we have that excessive energy that can come from 3 different sources that I will talk about. So this excessive energy, he calls it a noise. And that can be a factor that can interfere with sleep. So these factors are the body noise, and the mind noise, and also the bed or environmental noise. So those are the 3 things. I think I would start with assessment of those 3 stuff.
Okay. So looking at the body, the mind, and the environment, correct?
Yes.
And why do we need to make sleep a priority? Why is this an important issue to address? We touched on it a little bit, but can you go into a little bit more with that?
Yes, I think the sleep, like I was saying, more data shows that sleep is an important factor for heart disease, and it can also be a factor for cancer. They find that shift workers are at higher instance of heart disease, weight issues, obesity is a big deal if you're not getting enough sleep, and also any kind of cancers and several comorbid conditions, right, that they are finding are related to sleep. So I think if it should be part of a quality health management for anybody who's trying to optimize their wellness.
Wonderful. So in addition to the obvious of if you're not getting restorative sleep, you're feeling fatigued and possibly irritable during the day, it's also having a direct effect, as Dr. Raman showed us, on different aspects of your physical health. Wonderful. And then, so we talked about what insomnia is. We talked about why it's important, why sleep is important. We talked about some screening tools to screen and gain an understanding of how someone's sleep is, if they are obtaining restorative sleep. Now, what are some common reasons that keep people from sleeping well?
So this is where the framework is really useful. So because we divided the things that can cause excessive energy and they make it difficult to fall asleep can come from the body, mind, and bed. So if we start with the body noise, right? So nutrition, just like anywhere else, any other thing that we are trying to improve in health, nutrition plays a lot of important role here. By that, I mean, like if you are eating like very close to bedtime, and if it is a higher fatty meal, that can cause, that can increase your reflux symptoms and difficulty with the digestion, that can keep you up. And if you are eating too much carb-rich foods all the time, that can raise your inflammation in the body, and also weight, right? If you are having trouble with losing weight, and if your obesity plays a role with the difficulty to be falling asleep and comfortable lying down. There's so many physical factors also that go in with nutrition. And alcohol, I do want to mention, I think people think they can use alcohol or a glass of wine before they go to bed, but it can be in fact bad for you, because it reduces the quality of the sleep itself, and you do not get enough REM sleep, or the deep sleep that you can get. So alcohol will not help with sleep. And then caffeine, we all know about caffeine, right? Do not drink coffee, it's so close to bedtime, and maybe even reduce the amount you drink during the day. All these factors, I think, throughout the day, they do accumulate, and they can come into play towards the end of the night. Physical activity. Now, too much activity just before you go to bed, like between 3 to 4 hours or something, can make you can have trouble falling asleep. Or too little activity, even not getting enough exposure to sunlight. All those things can play a role. Prescription medications. I think people fail to realize, like if you read up on it, so many of the medications that we are on, not just psychiatric medications, even your blood pressure pills and everything, they all do affect your sleep. So when we come to management, I can go over how we can approach management also in 3 different ways. So that is with the body noise, right? Okay. And then when you come to the, I think we went back. Let's go back here. Technical issues, huh? Okay. Now, when we come to mind noise, right? So what happens is, I think throughout the day, we are distracted with activities and buzzing around all the stuff that happens around us. And then at the night time, when things are quietened down, is when all our thoughts and everything comes to the forefront. So if you have been stressed in the whole day, or if you have something, anxiety issues that's happening in the whole day, when you're lying down there, and that's when you start having all this excessive thoughts and recurrent thoughts, and all the anxiety, all those comes to mind, because it's been happening throughout the whole day. And mood disorders are so much correlated with sleep. I think I highly recommend anybody with sleep first needs to be first screened for mood disorders, because management of that will help a lot with their sleep. And then I think we also see that people who have chronic issues with chronic stress, right? Stress management should be an important part of management of sleep. This is all considered as a management of mind and mind noise. So when we come to the management part, I will talk about how we can use all these activities. And bed noise, by that I mean the environmental issues, right? So is your bedroom, how is your bedroom looking like? Is it cool enough? You know, they say the ideal temperature is 68 degrees, 69, something like that. It's got to be a little bit cool. Is it dark enough? Do you have excessive light that is going around you? And is it quiet? So you could use some things if you have excessive noise that's coming around you, and comfortable bedding, and going more green, you know, using the organic versions, reducing any kind of chemicals in the bed or in that atmosphere also helps a lot. And also sometimes there can be issues with psychological safety. So people who have had a past trauma or any kind of childhood issues and things like that have happened associated with sleep, those also need to be taken into consideration. That might be what's happening in that room. And then when you come to management, one of the things I can talk about is aromatherapy, right? You can use that as part of your bedroom environment, right? You can change that and keep that stuff, like usually things like lavender smell, and those are more soothing and conducive to sleep.
Wonderful. Thank you. I think that's really helpful. I think it's always helpful when we have kind of a framework to look at what's going on. And so looking at it in these 3 categories of the body factors, factors related to the mind and factors related to the environment is really helpful. I also think it's really valuable what you said that when you were going through some of these, that the effects are cumulative. So specifically, you mentioned it when you were talking about the factors affecting the physical body, that kind of what you're eating in the day, as well as alcohol or caffeine. All of those things have a cumulative effect on your sleep. And I'd like to mention also that within the categories, there's a cumulative effect, but there's also a cumulative effect among the categories. So in terms of things that are affecting your body may also, you know, added to things that are affecting your mind and added to things that are going on in your environment. So all of these things together can have a cumulative effect on your sleep and how restorative of sleep you're getting. So can you tell me a little bit about what would a holistic approach to sleep look like?
So I think we already touched based on that, right? So holistic approach is where you're trying to avoid use of prescription medications or hypnotics. I mean, they do have a role. We'll talk about that. But we are trying to approach more in terms of long-term care and in a way that we are trying to modify their lifestyle factors and help them to have a good quality of sleep for a long time. So when we do that, so if you can divide it up into different factors that we talked about, the body, the mind, and the environment, then the management becomes a little bit easier, like a straightforward thing, right? So if you look at the body wise, the management can include changing their diet, you know, don't eat so close to bedtime, avoidance of caffeine, reduce caffeine intake, reduce alcohol intake. And if you're not doing enough activity, maybe losing weight might help, right? Or add activity in the daytime, be in the sunlight. And prescription medications, sometimes we may not be able to do much with those if you need them and your doctor has prescribed those. But there is a really a great role for botanicals because they are very gentle and very, very gentle assistants to help people to sleep. And the side effects are so much minimal, and they can really help somebody to stay on it without any addictive capacity, without any addictive or withdrawal effects and things like that. I think everybody is familiar with melatonin, right? So we all have used melatonin for a long time. And the dosing doesn't have to start too high with melatonin. You can start as low as 0.3 milligrams up to 3 milligrams per day should be enough. And you can take it, like you need to take it at least 30 minutes to an hour before you go to sleep. And then some of the side effects I think people need to be made aware is vivid dreams, right? Because melatonin makes you have increased REM sleep, so people can have vivid dreams, which is not bad, which is a good thing, but people freak out about that. And there are some people who can be sensitive to melatonin, and they can have a paradoxical more wiredness. So they may not be happy if you prescribe if you prescribe melatonin and they come back to you and they didn't get a good sleep. And then the next one I like is valerian. I think it's the basis for Valium, right, in the benzos. So valerian root has actually anxiolytic properties in it also, along with helping with sleep. And it's really good to be used on a chronic basis, and the dosing of it will vary. And of course, when I tell people about any of the botanicals and stuff, always make sure they do not interact with any of your other medications, and they need to do not go outside and buy, you know, without any proper guidance by a certified doctor or anybody who's trained with herbal medicine. So I leave the disclaimer there. So valerian is a great one, which can be used for a long-term basis. Only problem would be you won't see the effect. The effect is cumulative, so it has to be in the system for 2 weeks or so before you start seeing the effects from it. And hops is a really great botanical. It's actually the component that is there in beer that we drink. So hops has been used in Native American medicine and everything like that. It's a great botanical. And 5-HTP, it is actually the foundation for serotonin. It increases serotonin in your brain and crosses the brain barrier. blood-brain barrier, and it can be a great supplement for you. And the dietary supplements wise, magnesium, it's really so good. It does so many things for people. I mean, most of my patients, the first thing I put on, I think everybody is deficient and we don't eat enough magnesium in our diet. And it's so much helpful for insulin resistance, for sleep, cramping, restless leg syndromes, constipation. It can address so many things. So, and you can start as low as 200 milligrams and go up to 500 to 600 milligrams. I also add iron in there, because if somebody is iron deficient, they can have more restless leg syndrome. So you may have to look at that, maybe do some labs, and maybe they need some iron in there, and things like B complex too. So that's where the body noise thing comes in. And if you look at the mind approach, right, with the holistic medicine, the best one for mind approach, once you have screened them for depression and anxiety, would be adding CBT, cognitive behavioral therapy. That is like a really basic guideline, I think they need to use if they're really having an issue with the mind that's causing them to not sleep. And for CBT also, you need to really go for a trained counselor. Make sure they are trained with CBT in sleep itself. Some of the ways that we can guide as a non-CBT trained doctors will be tell them to have a sleep ritual. I think we need to have a kind of a separation of our day from the night, right? So that's what the ritual will do for you. So develop something like you have your nighttime relaxation tea or a bath, and also get your aromatherapy going. So you are kind of separating your day, and that you're putting it away aside, and then you're starting your nighttime ritual. So it tells your body to start calming down, and the sympathetic nervous system goes down, and you start cooling down too. By stimulus control, I mean not watching too much of screen time. All this blue light does affect our sleep. So you got to keep the screen time out, and maybe use blue light filtering glasses and stuff for your screen. So that's a stimulus control. And also, I think not having too much high energetic conversations at nighttime, right? And definitely no arguments and things like that. Nothing heated arguments at nighttime. Those will cause also sleep disturbance. I do definitely add relaxation activities, which can be like simple things like having stretching exercises, yoga, Tai Chi, and adding some breathing techniques. I think there's so many resources out there that I think I've added them in my ebook about where they can find some free resources. In fact, hypnosis, right? Self-hypnosis is really good for helping people to fall asleep. And having some guided imagery, kind of whatever place relaxes you, being at a beach, swinging in a hammock, or, walking through a green forest. All these relaxation activities, I think you can practice, and they do help with reducing your mind noise, so that the natural sleepiness can take over. With the bed noise, I think we already talked about keeping it cool, dark, and quiet, and comfortable, and changing the environment around your bed area. Also, don't have electromagnetic fields, right? They do also can interfere with sleep. All the dials on all the watches, turn it away from you. And definitely no phone next to the bed, and no TV in the bedroom. All those things should be added to.
Great. So many wonderful, wonderful tips and suggestions and ideas for someone who is having some sleep concerns to get started.
Yes.
And I love that you just presented a wonderful toolbox for someone to, begin to start to maybe select one or two things to integrate into their life and see the effect that it has. And I love, we talked about how each aspect can affect another, and that's why this is such a holistic approach. So, maybe taking one or two of the tools that Dr. Raman suggested, and making a commitment to integrate that into your life over the next few weeks and see how you feel, see how it affects you. Now, another question I have for you, we talked about how some prescription medications can lead to sleep disturbances. Is there a role for prescription medicines to help with sleep disturbances? Is there some role for that as well?
Yes, I think prescription sleep medications can be used, but there is a role for it mostly in an acute setting. If somebody is going through an acute grief, then you need a fast-acting medication that can help with sleep. Or if somebody is going through some acute trauma or pain issues, because botanicals do take time to build up in the body. Melatonin can be a fast-acting too. But I think hypnotics and the prescription drugs, when they are used, should be only for short term, so that people don't develop dependency on it. And like we talked about, the quality of sleep, the prescription, the hypnotics prescription medications, they do not reduce the noises that are happening. All they do is increase your sleepiness. So that can have some repercussions on the next day. You may still feel tired and not getting a good quality of sleep and not getting enough deep sleep. So if they are used, they should be only for a short term and only for an acute situation, maybe to get over some things that's happening. But long term, I think we should approach more on the holistic way.
I think that's a really interesting point to make, that some of those prescription medications may help you fall asleep. They may help you stay asleep through the night, but you still may not be getting quite as restorative of a sleep as you would if you were to take some of these more holistic approaches. I also love that you mentioned that these approaches that you're talking about are really intended to really help you improve your sleep long term. So, and that's, one of our goals in with lifestyle medicine and with everyone who's presenting through this summit is really to give you tools that can help you in the long term. And I really love how you emphasized that. So thank you for that, Dr. Raman.
Sure.
What are 3 top takeaways that you would like our listeners to get from everything that you shared with us today?
I know. I think there was a lot we discussed, starting from the causative factors to the management. But if you remember only 3 things, I would suggest is, if you're having struggling with sleep, try to maintain a sleep diary, and then try to distinguish where is your sleep issue coming from. Is it coming with the body issues, body noise? Is it mind noise? Or is it a bed noise? And then you can slowly kind of fix each thing one at a time, and you can make your own assessment. In that way, you can manage each one, like we talked about, correct each aspect of those things at a time, and then see if it improves. Sometimes people may end up needing botanicals to fall asleep. But I think overall, if you approach in that way and figure out where exactly is your issue coming from, you will get more help. And but do focus on fixing your sleep. It is an important aspect of maintaining good health.
Wonderful. Thank you. Thank you for sharing your wisdom with us. And if people want to find out more about you and the work you're doing, and I know you did mention a free ebook that you just created, where can they find you?
Yes, thank you, Sheetal. It was my pleasure to be here today. My practice is located in Dallas, Texas. We are in the suburbs called Murphy and Rockwall. Our office, we focus on holistic medicine, kidney care, and weight loss. My free ebook is available on my website at excelhealthmd.com. There will be a lot of free resources in there online that you can use. There is also a CBT app also available, I believe for free, from the Veterans Administration too. I'll leave a link in there. I'll also leave a link in some of the botanicals and stuff we talked about. We also have a Facebook page under Excel Health MD, and I'm on Instagram at Excel Health MD Dallas. And anybody wanting to reach us, we also have an email address, info@excelhealthmd.com. And I hope this talk has been useful to you. And thank you, Dr. Asmani, for bringing us together.
Sure. Thank you again, Dr. Raman. And for those of you listening, thank you for tuning in. Please leave a comment below to let us know your biggest takeaways from Dr. Raman's talk on sleep and insomnia. Be sure to keep tuning in all week. We have lots of more great information coming your way. And remember, this summit is free, so please like, comment, and share to help us spread the word. Thank you again.
Thank you. Bye-bye, guys.